everybody. Today I will be introducing a private member's legislation to help stem the growing abuse of a popular pain medication in communities across the province. I'm pleased to be joined today by North Bay and Area Community Drug Strategy Committee Chairperson Patricia Cleash and Detective Constables Brad Rayum and Tom Robertson from the North Bay Police Service. These are the people who've played a critical role in developing what we call the Safeguarding Our Communities Act, what will commonly be called the Fentanyl Patch for Patch Return Policy 2014. They'll speak more in detail about the proposed legislation momentarily. In summary, the bill would implement a fentanyl patch return policy pioneered in our riding of Nipissing in communities across Ontario to help them deal with what is becoming a growing concern from both a health, social, and criminal standpoint. The bill would give healthcare practitioners across Ontario greater control over fentanyl patches, which currently are being sold illicitly for large sums of money to addicts. Just last month, a North Bay man was arrested and charged with drug trafficking after police seized 59 patches with a street value of more than $23,000. In May, Barrie police arrested 8 people connected to a fentanyl patch scheme with links to both North Bay and Toronto. I believe the approach advocated in my bill, which has already produced positive results in North Bay, and is a model that will curb dangerous and growing trend of fentanyl abuse across Ontario. I'd like to turn the floor over to my friend Patricia.
Thank you very much. On the patch for patch fentanyl procedure, we started this in September when the North Bay Police Service approached us and expressed concern about the number of fentanyl patches they were seeing on our city streets in North Bay, and said, is there anything we can do together to curb this number of narcotics that we're seeing? So we approached Dr. Preston and our Chief of Staff at the hospital, and that was in September. We contacted a Mark Barnes, who is a pharmacist in Ottawa, running a single program by himself in Ottawa, who sent us a small procedure that he was doing. And together, we developed a protocol with our strong partnership. And I have to stress, it only works in a strong partnership. Enforcement, pharmacists, and physicians, we came together and initiated this protocol on December the 6th across the district of Nipissing. So it is working extremely well. We've hit some bumps along the way, which we are working on. I'm going to show you, in case you don't know what a fentanyl patch looks like. It's a little plastic patch. We're asking people that are on the fentanyl patch to return it. The physicians now know that they can only order 10 patches a month, because these last 3 days when we put them on a patient, and they have to return them to the pharmacist. We have a sheet that they return them on, and it seems to be working extremely well. This protocol has gone across the province. It's amazing what places have picked it up. It's been initiated in St. Thomas, Peterborough, Manitoulin Island, and I think, if I'm not mistaken, Chatham, Kent. But we've had great support for our procedure. But when we approached our MPP, Mr. Fedeli, in August, you got to understand, this is moving very quickly for us. He said, I'd be more than happy to help you. So we have to give kudos to our MPP, who has now taken this here. So now we have a private member's bill on the table. So now I'm going to turn it over to my policing department of buddies here to talk about their role in this fentanyl patch.
Okay, well, like Pat said, early of last year, we were recognizing the people who were starting to abuse fentanyl. The word fentanyl started popping up a lot more. Prior to last year, we didn't hear much about fentanyl at all. So basically, you know, we found out how people were using the fentanyl, and in order to use a fentanyl patch improperly, people have to actually destroy the patch. So in destroying the patch, you know, we started thinking that, well, like, if they destroy it, they can't bring it back, and if they can't bring it back, that's a good indicator that they're abusing the fentanyl, possibly trafficking it or using it themselves illegally. We did some research. We believe that we would be able to find somebody, police force in Ontario, that was doing this program, and we were unable to find a police force doing it. We found a pharmacist by the name of Mark Barnes. He's a pharmacist for the Westboro PharmaSave in Ottawa. He sent us his program, and we contacted Pat with that program, and she took the ball from there.
Yeah, the initiative was designed to decrease the mortality rate, because fentanyl is 100 times stronger than morphine, and since from 2007 to 2012, we've had 13 deaths in the city of North Bay directly linked to the abuse of fentanyl. What we're finding is people abuse fentanyl by smoking it, so they inhale it, and again, it destroys the patch, so we can't return it if it's destroyed that way. They chew on it, and again, it destroys the patch that way, or they inject it, and it also destroys the patch. So really the no-brain solution to eliminating fentanyl abuse in the city of North Bay was to have the individual return it once they're prescribed the fentanyl patch. Like Mr. Fedeli said last month, we arrested an individual with 59 fentanyl patches. So what we're hearing now are people attending the city of North Bay from other communities, given the fact there's a huge revenue generated from the sales of fentanyl. In North Bay, the 100 microgram patch that Pat has in front of us sells for $400 or more. As we go north in northern Ontario, the smaller communities, Timmins, James Bay, they sell for double that. So in North Bay, they're $400. What people are doing now, because you have to return them in North Bay, that they're seeking the fentanyl from outside of our community.
So in a nutshell, when somebody goes to their doctor and gets a prescription, either faking an illness and getting a box of 10 of these, right now they're cutting them up, selling them. This $400 patch brings a lot of revenue in. The whole purpose of it is if they have no patch to bring back, they can't get a new one, and they move on to the next pharmacy. But by putting this program province-wide, and that's the whole purpose of the private members bill, is to make this illegal throughout the entire province, then there will be nowhere for them to go. And so that's really, in a nutshell, the purpose of it. And not only the new patch, but the used patches, which are being retrieved from dumpsters, go for about $150 a patch. And so this would stop people from throwing them in their garbage and having them raided, by also having the necessity to return the patch. So I want to congratulate all of you on what is an incredibly innovative and exciting promotion. This is an opportunity to save lives in Ontario, and I commend all of you, and I will be looking for continued support here in the legislature to make this fentanyl patch for patch program universal in Ontario.
And we thank you for your support.
Oh no, this is your doing, and I congratulate all of you. Thank you very much, everybody.
Thank you. Thank you.
You'll need that.